So that's what I tell my patients is like, we should test your iodine levels. So that way we're not just making stuff up. We're just blindly telling you to do something.
Well, if it
So
were a perfect world, we would do that. Yeah. There have been so many papers about iodine testing, and we've got
yeah,
lots of data points saying that many tests work great for populations. But iodine is capricious. The amounts in the body are not stable, and the amounts in the body are not uniform. So the body is not a bucket that you could just put a dipstick in to measure how much iodine is in the bucket. The amounts in the thyroid, how the thyroid responds to it, the amounts in the blood, the amounts that we excrete in the urine, the amounts in the hair, they're all different and they're all regulated internally in different ways. One of the last papers looking at the accuracy of thyroid tests for individuals was looking at urinary tests. They're the closest to meaningful. Serum tests have no meaningful correlation. So, blood tests for iodine, if we consume so much our kidneys cannot clear it, then our serum levels go up. And those tests are totally appropriate when someone's been given a medication like amiodarone, or they've had a high amount of iodine from contrast, and it's at toxic levels and it's been there for months. So blood tests can show that. But below the toxic thresholds, whether they're higher or lower has no relationship with one's nutritional status. That's pretty irrefutable in medical literature. Then urinary tests, once you're tracking more than 500 people, they're very good, non-invasive, inexpensive ways to gauge the iodine status of a population. But to track an individual, the last count showed that you need at least 20 tests to be within about 85% predictive value. So yeah, for individuals, they're pretty close to meaningless. And that's the tough thing. Many will say, oh, I did an iodine test and I was low or I was high, so therefore I need, it doesn't mean that. You can track iodine intake by simply doing an inventory of how much you're consuming. And there's no known variations in iodine absorption. So what you're consuming is pretty much what you're getting. So the more accurate way at an individual level is to look at the overall intake from sources. But yeah, the tests are simply not accurate.